We know as working urologists that there is often patients present very late in their disease process and have had symptoms for some years. I think the value of Urology Awareness Month is to try to improve the general public's perception of urological symptoms so that they can interpret these and present to their medical healthcare teams much earlier in their disease process. It is therefore likely that we're more able to offer cures or certainly improve their quality of life considerably the earlier they come to see the urologist. The Urology Foundation has sponsored the Urology Awareness Month, and I think their aim is to spread knowledge of urological health, breaking down the stigma associated with many of its conditions and persuading people to talk about it. They have the opportunity to raise awareness across the board, and the charity is keen to involve as much of the general public as possible in this. The Urology Foundation surveyed more than 1,000 men and women across the UK recently, just to gain an understanding and insight of their knowledge of urological health and if they think it's important to them. And the results are most interesting. 16% of the UK were unaware what urology actually is, and a quarter of the UK did not know what areas urology covered. Over a third find talking about urological conditions embarrassing, and of course men and the younger generation were more embarrassed than their elders and betters from the fairer sex. Males are less likely to know what urology covers, but actually the paradox of that and the sad news about that is that, of course, they are the ones that are at a slightly higher risk of developing urological disease than females. So, of course, prostate cancer only occurs in men, 72% of bladder cancer sufferers are male, and 62% of kidney cancer sufferers are male, and urinary stone disease is commoner in men than female. So in some ways it's confirmed what urologists believe and what the urban myth is, that a lot of the urological conditions have stigma associated with them. Patients have poor understanding of them and unfortunately present late to their healthcare professionals. And the Urology Foundation survey has allowed us to quantify that information. In Britain, we're a reticent population. We like to keep things to ourselves. And unfortunately, the urological conditions are associated with areas of the body that there are stigma associated with it. So first of all, passing urine, it's not a sort of dinner party conversation. How do you pass urine? And so patients are reticent talking about that. And then, of course, a lot of the other symptoms relate to the genitalia. And again, men in particular are very unhappy talking about the penis and their testicles unless it's part of a joke or some other banter between individuals. But certainly if there's an underlying condition associated with it, men are very reluctant to seek help. I'm not completely convinced it's from a lack of knowledge. It's often part of our personality. And what the Urology Foundation are trying to do is to build awareness and to encourage people to increasingly talk about these conditions so that they present to their healthcare professionals earlier than they would have done otherwise. The symptoms of urological disease vary very widely across from pain to symptoms specifically related to the genitalia or specific symptoms related to urine. I suppose the areas that we should concentrate on are underlying urological cancers. And of course, urology covers a fifth of all known cancers. We're involved in kidney, ureter, bladder, urethral, penile and testicular cancer. And one of the commonest presenting symptoms is visible blood in the urine. And anybody who sees blood in their urine should seek urological advice out as soon as they can. The very good news is the NHS has done a remarkable job in the management of blood in the urine, and you can be guaranteed to be seen in your local NHS hospital within 2 weeks of seeing your GP to be investigated to exclude any underlying urological malignancy. The perhaps less well investigated and less well supported urological conditions are erectile dysfunction, recurrent urinary tract infections, urinary incontinence and stone disease. And patients can present in a number of different ways. Clearly, urinary incontinence is the involuntary, unheralded and unwanted spontaneous leak of urine, which can be extraordinarily embarrassing, have a major impact on quality of life, and not a symptom that patients want to discuss. And it's been estimated that up to 12 million women in the UK suffer from some degree of urinary incontinence. Erectile dysfunction probably speaks for itself, and again it's estimated that up to 50% of men over the age of 40 suffer some degree of erectile dysfunction, and the patients that come to see us are those usually who find now that penetrative intercourse is not possible because of their erectile dysfunction. Urinary tract infections, most people would understand what cystitis is, and that's the classical scenario of painful voiding, frequent and urgent use of the toilet, quite often very unpleasant suprapubic, and by that I mean pain just behind the pubic bone, discomfort as well. Urinary stone disease, and I'm sure your listeners are aware of the dreaded acute urinary stone, which can be absolutely dreadful, with the most ghastly pain you can imagine, requiring the patient to attend A&E immediately. But equally, their stone disease can present in a much more insidious manner with low-grade loin pain, and the loin is the area in your back between the bottom of the ribs and the top of the pelvis. I think that probably covers the majority of common presenting symptoms. They should certainly seek out healthcare advice. They can go to the websites, of course, first of all, just to check that they are suffering from symptoms that are appropriate to be investigated further. And the Urology Foundation have a very good website at www.theurologyfoundation.org. And equally, the patients can see their GP, and if not the GP, they can see the practice nurse or any allied healthcare professional who can encourage them and investigate further.